Good afternoon, everyone. Welcome to the Jefferson County Health Department Board of Trustees meeting, September 30th, 2025. It's 4 p.m. Please make sure your cell phones are on mute or silenced as we move forward with our meeting today. I will call this meeting to order now. Our first order of business is the Pledge of Allegiance. Mr. Deal, would you please lead us in the pledge?
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I could remember that.
Thank you, Mr. Deal. Ms. Pinkley, would you please do a roll call?
Mr. Pig?
I am here.
Dr. Henry?
Here.
Ms. Stidham?
Here.
Mr. Deal?
Here.
Ms. Taylor? She is stuck in traffic, but is en route.
Ms. Henry, would you please read our mission, vision, and purpose?
Sure. The mission is to promote positive health outcomes through delivery of foundational public health services. Our vision is a healthy Jefferson County, and the purpose of the health center, the JCHD, is established, maintained, and operated for the improvement of health of all inhabitants of Jefferson County.
Thank you. Now we need approval of the agenda as presented or make an amendment. Do I have anybody to approve the agenda?
I'll make a motion to approve the agenda as written.
There's a
I'll
first.
second.
I have a first and a second. Is there any discussion on the matter? Not hearing any. All in favor, please say aye.
Aye.
Any opposed? Motion carries. I know we have two guests. Welcome today. Moving forward, the approval of the August 28th, 2025 meeting minutes. Do I have a motion to approve those?
I'll make a motion to approve the minutes.
I'll
For-
second.
Having a first and second, is there any discussion on the matter? Not hearing any. All in favor, please say aye.
Aye.
Any opposed? Motion carries. Next is approval of the September 2016, 2025 tax rate meeting minutes.
I'll make the motion to approve.
I'll have to second. Well, wait a minute.
Yeah.
Point of order, question to you, since there's only two of us here that were here on that meeting, the third one's not here, Mr. Deal and Ms. Stidham were not here, do we have to hold those off? Okay. All right, so we're gonna have to hold those off because we do not have a number of present here to pass those. All right, moving forward, approval of the August 2025 expenditures for $45,198.37.
I make a motion to approve.
I'll second.
Having a first and second, do I have any discussion on the matter? Not hearing any, all in favor, please say aye.
Aye.
Any opposed? Motion carries. Approval of the August 2025 electronic payments for $505,422.88. Do I have a motion?
I make a motion to approve.
Do I have a second?
I'll second.
Having a first and second, is there any discussion on the matter? Not hearing any, all in favor, please say aye.
Aye.
Any opposed? Motion carries. Next is pre-approval of the October 2025 electronic payments for $638,537. No pennies. Do I have a motion?
I'll make a motion to approve.
I'll second.
We have a first and a second. Is there any discussion on the matter? Not hearing any. All in favor, please say aye.
Aye.
Any opposed? Motion carries. Mr. Sykes, the floor is yours, sir.
Okay, thank you. Quick report for me. First thing I want to do is I think we had a very successful dedication open house ceremony. I believe as far as the dedication itself, there were over 100 people, including some of our employees out there. But I think that was one thing we didn't do, is count those who came through the building, but there were over 100 people that toured the building that day. So we had a very good outcome on that, and I appreciate the staff, all the hard work they did, especially Brianne, who put a lot of that together. And it made me feel really good to see all the people come out and support us on that, so I appreciate that. I also wanted to announce that we are starting to utilize this building. The new design that we put in was the canopy, and we are going to have a drive-up flu clinic in October the 10th. We're going to try it out. That's why we put it there, as one of the purposes. So I think it's already out on social media about what we're doing, and hopefully we'll have a good first run at bringing people to the canopy. The next thing I want to do is introduce our medical director for the health department and have him come up and introduce himself and talk a little bit about himself and what he does here for the health department. So, Dr. Goudreau, would you mind? Thank you.
Hi. Hello, everybody. I'm Dr.
this on?
Pascal Good. Is it on?
Got markers here.
Okay, I'm Dr. Pascal Goudreau. I've been what would be called the medical director here since, I think, 2019. I'm a full-time practicing physician with Mercy in primary care. I'm a family practice doctor in Festus. Back then, the health department approached the leadership at Mercy. Apparently they had needed a new medical director, and they asked me if I would do it, and when it was explained to me what it involved, I said yes, because I feel the work of the health department is vitally important, and I want to do everything I can to support the community. So, I don't know, I've never been to one of these meetings. I never even thought about coming, because my duties, basically being called the medical director, is kind of overblown, because I don't really direct anything. I'm not in the decision making, I'm just in the overseeing aspect of it. I look at the protocols, what we call standing orders, for what the health department does, and as long as things are within standard medical practice, I have no reason not to approve them. And that's what I have done all this time. Once a year, they ask me to look over the whatever it is, yeah. And I've looked at them, and I've never seen anything that is unusual. So that's what I've done. I also am in collaborative practice with Mary, the nurse practitioner who's in your van. And this is something I also do with Mercy, so this is nothing unusual. I review charts, and if she has any questions or problems, I talk to her, and we discuss the matter and decide what to do. Mary's very good. She doesn't bother me very much. Mostly it's reviewing the charts. So that's basically what it is. Again, I've been thinking about this. It's like, yeah, medical director is kind of an overblown term. And this is not unusual. I've done this sort of thing in the past. I've been a medical director for, when I was in Texas, a rape nurse examiner group for our county. I didn't have any special expertise there, but because the laws are written that a doctor has to initiate orders, they have to have a licensed medical doctor to be behind these things. And they're, again, standing orders, and as long as they're standard medical practice, there's no reason not to do it. And same other, I think this is a fairly common way of doing things. I suppose in a bigger area, like in St. Louis, they would have a doctor with more health background, you know, maybe a master of public health who does, you know, these sort of things and has a lot of training, but I just don't think this is feasible for this area, as you probably have to pay them. And I'm here as a volunteer.
And
Thank you very much,
Thank
yes.
you for your service. We
All right.
greatly appreciate it.
All right.
All right, thank you very much.
Thank you.
So with that, and he mentioned, you know, the medical director, is that the term we want to continue to use, and we can discuss that. The other thing, I think the discussion was, should he be under contract or have an MOU, which we currently do not have, and the way we read the laws and the way Dr. Goodrill wrote, we're not required to do that. We do have to have standing orders that he signs and our nurses sign, and we do have that. I did, as the board wished, we did talk to some other counties, and it's kind of all over the place. I mean, some have contracts. I talked to Clay County. Clay County is Kansas City area. They're fairly comparable to Jefferson County in size. He said, their administrator said that they do have a contract, and I have a copy of that, with their medical director, but the medical director has never asked for any reimbursement from them. So it really kind of acts like an MOU in a way. So we've reviewed some MOUs. We have one that we have put together. Of course, it would probably need to go to legal, and you would need, yeah, yeah.
Of course it would.
So,
If it's any type of, sorry, I didn't interject, but if it's any type of an MOU, it needs to be pretty light and cover exactly what, you know, the doctor's doing.
yeah, so
Nothing outside that scope, but
I talked to the Department of Health and Senior Services, the director of policy, health policy, on this topic, and Jetty and Melissa were in the meeting as well, and he kind of, I think we're on track with what they're seeing across the state. It's, some just have standing orders with a doctor down the road, some have an MOU. Larger health departments may have a medical doctor on staff, but that's going to be maybe Kansas City area and St. Louis area. I don't know about Springfield, but I think the process that we're using here is the accepted process. It's just a matter of the paperwork of standing orders, or do we want to go a step further with an MOU? I don't think a contract is necessary, because we aren't paying, and he's not asking for any money. So, but anyway, we can discuss what you, and if you, is the term medical director, do you feel there's no requirement that he is called a medical, I think the language is, like with Mary, he's the collaborative physician. With our nurses, he's a consulting maybe, or something like that. Physician is what the law states in the statutes, but the term medical director is only used, I think you had talked about the emergency ambulance districts, things
Yep,
like
I know
that.
they
use
have their one,
medical,
right.
the medical director, but that would not fall under us, so.
I thought the state statute does include the term medical director. It does not? Not for us, EMS boards do. Really? Okay.
Yeah, and from what we researched, we couldn't find it, and the policy director didn't mention anything about that as well. So, I mean, we don't have to change the term, it's just, it's whatever.
well, MOUs are it's non-binding. It's just a handshake, basically, is what it is on paperwork.
Yeah, but it would spell out, like you were saying, what is the expectations from each party. We just put it in writing. So we can explore that some more if that's what you all want us to look at. Or do we just stay with the standing orders and go with that?
Well, if it ain't broke, why fix it, right? I don't, I think it's good that we met him and know what he does, but we've been functioning this way for a very long time, and we have not had a problem. This is a volunteer position. I don't think, that's
Okay.
just my opinion.
And I presume, Doctor, you're okay with continue on as it is? Yes. I've never had a problem yet. Okay,
Would you like a title change?
all right. Okay.
Thank you.
Well, that's all I have for my report then.
All righty, is there any board trustee questions on the program report that was issued out to everyone? Anybody have any? All right, not hearing any. Is there any public comments? Okay. Go ahead, Bree, who do you have? Give me 1 second, Ms. Downer.
1 second.
Well, you know what I meant, come on.
2.5.
30 seconds.
Counting down for you.
All right, when it hits 5, there you go. Go ahead.
Hi there, I'm Liz Downer. First, I want to thank you guys for the new building. The open house was really nice. I want to thank you guys. It was very informative. I liked all of the interactions of the vendors that were here. I got some pretty good information,
Actually, they weren't vendors, they're actually staff.
Oh, staff.
Yeah, it was all the staff,
Yeah,
all the things we
that was
do.
very interesting. I got a little booklet on the emergency response
Uh-huh.
that you fill in. I was like, everybody needs this book at your house, because it was a booklet where you can fill in, all of your information, the store, so like your kids have everything like right there. I was like, I'd never seen one of those before. I thought that was pretty cool. We should have copies of them, like, hanging out. The one thing I did notice that was in the office is the vaccine inserts for the vaccines that we give. We still have the little 2-page reports that come from the CDC website, but there's the other, and even when you scan the little barcodes, which I think that's kind of cool, those go right to that CDC website. There is a website that's actually run by Johns Hopkins Bloomberg School of Public Health, the Institute for Vaccine Safety, and it's a website that meets the criteria for credibility and content as defined by the Global Advisory Committee on Vaccine Safety. So that website is www.vaccine, V-A-C-C-I-N-E, safety, SAFETY.edu. And that one goes into, it's a full-on report. Like this one, I have a couple that I printed out. Some of them are 4 pages. Some of them are like 16 pages. But I'm sure that you guys are all aware of them, because this is probably something that you have to go over with your patients before a vaccine is administered. But I think it would be really cool to have the public be able to see those, to be aware of them, to know what, more information about vaccines, because it goes into indications and usages, dosage, administration, warnings and precautions, adverse reactions, it'll go into drug interactions, so people can actually look up, because falling back on our flu drive-through thing that we're gonna have, I think it's really important that we remember, a lot of people think, oh, it's just a flu vaccine. I get them all the time. But I don't think people understand we need to ask questions about reactions to other vaccines if the person's received them. Do you know that flu shots have been confirmed to interact with oral medications? There's a website, drugs.com, that lists 207 prescription meds with 675 brands and generic names that are known to interact with influenza vaccines. So flu vaccines can interact with 2 commonly used medications, which are Dilantin, which is a seizure disorder, it's given for seizure disorders, and Coumadin, which is a blood thinner commonly prescribed for seniors for atrial fibrillation. So the flu shots can actually lead to a sudden increase in the amount of drugs in the circulation, drugs in circulations. So I think it's important that, I don't know if you guys do, you might do. So do you ask about medications the patient is taking before you administer a flu shot? And I know package inserts are more information for the doctors and nurses and people administering the vaccinations. But like I said, I think it's really good for people to understand the depths of these, of this information that's in here. Because if you just look at the warning, like contraindications, do not administer Fluarix to anyone with a history of severe allergic reactions to any component of the vaccine, including egg protein, or following a previous administration of any influenza vaccine. So there's a lot of information in these pages, more than the 2 pages that we keep out. How much time do I got?
You're out.
I'm done?
Yeah.
I have one question for Mr. Sykes.
All right.
A couple months ago, I gave you the MAHA report and the updated MAHA report. I'm really curious as to your thoughts on that and what you thought about it. And that's all for me. Thank you.
Thank you.
Thank you.
No others? Okay, thank you very much. All right, so that ends our public comments. Next on the agenda is old business. There is no old business. On the new business, we have the 2024 Jefferson County Health Department audit.
Have Kristen come up and discuss that for us.
Okay. Not a fan of this microphone, but whatever. The 2024 audit was completed in August 29th. The main points of our audit are that the accounting policies and practices follow GAAP, which is the generally accepted accounting practices. All significant transactions recorded and recognized in the financial statements in the proper period. They had no difficulties or disagreements with management. Let's see, but however, they did find 2 deficiencies in internal control over compliance. The first one is non-compliance with reporting requirements for ELC contract. It was the 3rd quarter program progress report was not submitted by October 15th of 2024. It was submitted on October 31st. The difficulties we had with that were in September of 24, the contract changed their procedures for reporting and invoicing, but they did not have a training for that until November 12th, which was after the report was due. But because nothing was provided to us indicating that reporting dates would be extended, the auditors had to put it as a finding. There's a corrective action. They suggested we do a corrective action. So we will have a contract management dashboard. I'm creating it right now. We're going to keep it on the admin team SharePoint, and we'll be reviewing it monthly with the admin team. It will have keep track of the grants and the contracts, the due dates for the progress reports, financial reports, and invoicing, the submission dates for those reports and invoices, the contract amounts invoiced, the amounts remaining, and the percentage remaining, and then contract amendments. So that is our solution for that. The second one is an internal control over financial reporting. This has to do with the loan on this building. The First State Community Bank loan is actually set up, or the capital lease agreement is set up as an acquisition account, but accounting treated it as a loan to be recognized upon completion, but we should have recognized it as we were going. So what it did is that it threw off our accounts payable, making it seem as though our accounts payable was understated at the end of the year. And it also caused the general fund's 2024 expenditures to exceed the final approved budget amount. So the corrective action for that is that we're already recording the acquisition account in our accounting software along with the loan disbursements as accounts payable. And the corrective action regarding the budgeting, we're reviewing the annual budget quarterly, which we've been doing so far, and requesting revisions as appropriate. So, let's see. We have the 2025 third quarter budget revision, which is going to include the loan disbursements fiscal year to date. So that is where we are with the audit this time.
So you won't have any questions before I make a comment or two?
So the over expenditure was due to the way we accounted for the building?
Yep, for the loan disbursement, we had a December payment to Brock Miller that we didn't receive till January, but obviously I didn't report it as an accounts payable because I was going to record it as a loan upon completion, so.
Are any other questions? Okay, I appreciate everything you do, and I know you're taking this pretty damn hard, but don't. Because, okay, just so everybody knows, and I want everybody to know this, wherever you're at, this is exactly why you do audits, okay? This is a process thing. It's not anything bad. I know you got it fixed, I know you're moving on, and I appreciate everything you're doing. Go sit down. You can go sit down.
Do you
But
want me to stay up here for the budget revision?
Well, if you want to, but I do want to make sure everybody understands that, you know, this is what you're doing. I mean, there's no fraud going on, and this is the thing you look for, and that's the worst thing you want to have happen, is come up with something like that. This is really, you know, this is minor stuff, so I do appreciate it. So go ahead. Now that you've making us do a revision, because you got,
Do we need to approve the budget or the audit, or no, we're good? Okay. All right, then the third quarter revision, I've included in there, you can see that it is lower than the previous 2025 approved budget. It's because we took the COSIP grant by 1/4 of what it was, as we have not started it yet, and there's only a quarter left of the year. Most of these changes are in relation to that, and then some of the like Medicare, Medicaid, and insurance payments, I just suggested to forecast what it should look like at the end of the year. So those are the changes.
and we need to approve this, correct?
Yes,
To keep
you
all
do.
of us in compliance with the auditor people?
Yes, please.
Okay, so I'm looking for a motion to approve the 2025 budget revision, third quarter budget revision. Can I have a motion, please?
I'll make a motion to approve the third quarter budget revision.
I second it.
Having a first and second, is there any other discussion on the matter?
So if some of the grant funds that are in the budget are not provided, how do we account for that?
Our guidance so far is to wait until we hear from the state. They haven't received any guidance yet from the feds on what to do past today.
But we haven't implemented this grant funding, is it? For
Right.
the COSUP grant?
Mhm.
Yeah, we've not,
No,
due
just-
to a lot of the unknowns, we didn't want to jump into that yet. We're going to review it and see if we're ready to go yet or not.
Yeah, I'm just asking in general for,
We were told to continue business as usual until we hear otherwise,
Yeah.
is what the state has directed.
All right. Any other discussion points? So I'm going to call for a roll call vote on the third quarter 2025 budget revision.
Mr. Pegg?
Yes.
Dr. Henry?
Yes.
Ms. Stidham?
Yes.
Mr. Deal?
yes.
Ms. Taylor?
Yes.
Motion passes unanimously. Thank you. Next on our agenda is the CDC and FDA updates, and I think also as well as anything from the state. Steve, what do you have, anything?
Well, I know that there's a lot going on with the ACIP committee and how that relates to CDC and how that trickles down to us. And really, and Melissa, you can correct me, I mean, so far, nothing has really changed on our end. Some of the ACIP recommendations have not been fully approved by CDC or accepted by CDC. When they are, then there may be some changes coming to us. But on our daily, what we do, there's nothing that has changed what we're doing. Am I correct in that? Okay. So that could there could be some things here, once they approve some of the later recommendations from ACIP, which I figure they probably will, I'm not sure. Then we have to see how the state will incorporate that, because some of the statutes, the state statutes, has specific, this is this is what you will do. Some of them actually say you will follow the ACIP, so it may have to work, they may have to change the statute even on some of this, so we'll see how it goes. That's really the only update I have on CDC.
Any questions by,
I do
Trustees?
have a quick question. I know a lot of people have reached out to me, and a lot of people are talking about the combination vaccines, like the MMR and the Pedrix, I guess it is. Do we offer single vaccine? Do we offer like just a measles, just a mumps?
Used to be.
We don't? Okay.
And that was one that
I
I
know
think
that
has been accepted, that changed, but that didn't affect us because we didn't give that anyway, so.
So I know that is a concern, doing so many at one time. If they could get them singly,
Yep.
would be better, so. Okay, thank you.
all right, any other questions? All right. Next is entertaining topics for the next agenda by trustees. Limit to 3 topics, requires a second. Does anybody have anything? Okay, not hearing any. Closed session, we do have okay, unfortunately. Need a motion to go into closed session, please?
I'll make a motion.
Do I have a second?
Second.
Is there any discussion on the matter? And this is pursuant to 610.021. Any confidential or privileged communication between the Board of Trustees, Jefferson County Health, and or its representatives and its attorney, and records which are protected from disclosure by law, and we do have a set of minutes. So we need a roll call to go in, please.
Did we have a first and a second?
Yes, we did.
Okay. Mr. Pig?
Yes.
Dr. Henry?
Yes.
Ms. Stidham?
Yes.
Mr. Deal?
Yes.
And Ms. Taylor?
Yes.
Are we going to have any reason to come back to do any, we're not going to have anything to come back to? Okay. So there will be nothing to report from the closed session. Thank you, folks.